Hello,
Hello
Dr. Amy
there.
Beacom. I am so glad to be talking with you today. First,
Oh,
we'll introduce ourselves. We'll talk about Center for Parental Leave Leadership, and we are live. We're
right.
also being recorded. So if you're joining us live, please feel free to write in questions, and our wonderful moderator, Director of Communications, Jessica, will be moderating that for us. And also, because it's taped, you'll be able to access this, and maybe you are now accessing this at a future date. So, Amy, I'm so glad to see you.
It is so nice to be here with you. I haven't seen you face to face in a year since the PSI conference last year. I was
That's
thinking, is
correct.
that true?
That's correct. We
Oh,
have a PSI has Postpartum Support International has an annual conference every summer. We like to go where it's hot, especially apparently. Anyway, we're in Washington D.C. last summer, and you were there doing a wonderful seminar, actually about the Center for Parental Leave Leadership and parental leave coaching. It was so great. I was there for the whole time, and I loved it. And then also this year we're going to be in New Orleans the second week of July. So I appreciate so much that you sent in a proposal to be at the PSI conference and this is what we're going to talk about today, the intersection between perinatal mental health and advocacy and support and policy and parental leave policy and coaching and management training and all of it. You and I know about this intersection, but I feel, Amy, like it's really new and emerging. So I'm going to first, we're going to do some introductions, and I want to just get into that conversation. Does that
perfect.
sound good?
Perfect. Yes.
Um, I'll go first, and then Dr. Beacom will introduce herself. I'm Wendy Davis. I am the president and CEO of Postpartum Support International, postpartum.net, and I started as a volunteer. Well, I started as a new mom before I even knew about PSI or anything like this existed. I was trained as a therapist and a waitress. Call out to waitresses, yay. And I always say that I use both of those sets of skills pretty much equally, which may be surprising, but you learn a lot as a restaurant worker, making things work for people individually and collectively, and know what you need and know how to listen and never let them see you run. Am I right? So, so I feel like I should have known about perinatal mental health by the time I finished my doctorate degree in psychology. Sadly, I did not because it wasn't taught. And that's still true in many, many, many academic institutions. So, my crash course for myself in pregnancy and postpartum mental health is when I got postpartum depression and anxiety after the birth of our first child. And that led me to start volunteering, started Baby Blues Connection, parent to parent support group in Portland, Oregon, and then start volunteering for PSI. Flash forward to now. I am now the president and CEO. So, as many of us have experienced, my background has been super helpful, but my lived experience of the crisis and the recovery really is what launched this specialty and gives me passion. And I think I know empathy, but also kind of information, right? About what I needed, what wasn't there, and what I'm just compelled to make happen for other families. So still in Portland, Oregon, my babies are 28 and 31 now, but in my heart, they're my babies. And that is me, Amy.
Oh,
Can you introduce yourself?
2031. Oh, well, I'm going to go backwards then because my first baby is 18 and graduated high school this last week, heading off to college. So, yeah, my introduction to perinatal mood and anxiety disorders was also with my first child, where I was quickly, well, should I say who I am first? Let me say who I am first. I'm Dr. Amy Beacom. I am the founder and CEO of the Center for Parental Leave Leadership. I am also the founder of the field of parental leave coaching and consulting. So when I had my first son, this didn't exist. And at the time, I was working on my doctorate at Columbia, and I was focused on executive coaching and leadership development, mostly around women's economic advancement and women's leadership. And then I had a kid and was like, oh my goodness, this is not what I was prepared for. It wasn't what my work world or my academic world talked about. I had been, I don't know, I sort of saw myself as an expert in work-life balance. I, at the time, had spent years teaching companies how to do things like flex work. And, one of my favorite memories is I live on the West Coast now. I was in New York for 14 years, but I'm in Portland also, where I was back then. And I would take companies who would fly out to the West Coast and take them on what we called a work-life tour of progressive West Coast companies. And so we would go and we'd stop at Levi's in San Francisco because they had one of the very first job shares of 2 senior level women, and taught them what a job share was. And then we would drive down in our little convertible to Patagonia and say, this is what flexible time shifts can look like, where everybody could go surfing whenever they wanted or work whenever they wanted. They also had what was called a lactation station back then, which was the first breastfeeding room. This was 25 years ago. And when we do that, and so I thought I knew what I was doing. And then I had my kid and was like, oh my goodness, I do not know what I'm doing at all. And neither do our workplaces. And so where, Wendy, you took it into the therapy realm, I struggled with my own postpartum depression and anxiety. And that led me to create a field of parental leave coaching and consulting for organizations, because that's where my background was. And so trying to help fix things on that side. And back then, paid leave wasn't a thing, right? It was, people talked about maternity leave, but parental leave wasn't even a word. The parental leave transition wasn't a phrase. I was the first person to talk about, like, there's this thing called a parental leave transition, and it has a beginning and a middle and an ending. And let's talk about it this way and create structures around it. So, yeah.
So do you feel like when you started to talk about that, what you were just saying, like there's a parental leave, it's an actual time of our life. It's a period of time, just like back in the 80s, people started to say postpartum. It's an actual experience. It's a time. So when you started talking about that, when was that, would you say?
That was when 2006. So okay. Almost 20 years ago.
It's crazy. And
yeah,
were you already thinking about this before you got your doctorate degree?
I was thinking about it in terms of attrition and women's economic advancement and within workplaces, because what I was already seeing was, and why I waited a long time to have my own children, is that most women who were career-minded, or career identified, as we called it back then and still sometimes do, they had a really difficult time, and we were having a huge attrition rate. Women would fall out and be forced out of the workforce. And that's when some of the first, when was it, like 2010, 2012, we started getting some of the first articles about offboarding and onboarding and women's job roles. I can't believe I'm blanking on her name, because she's one of my favorite early authors around this, but Anna Marie Slaughter started to write around that. So yeah, it's been a while.
And, it's okay. It's kind of like when you're an advocate and then you're a learner and a teacher, sometimes there's this kind of, I think it's a false dichotomy between, well, we don't want it to all be about productivity and capitalism, but it's also like, well, if that's what it takes for corporations, insurance companies to understand how important it is, that's okay. Because the reality is that workers want to be productive too. We might measure it in different ways, but I think it's important for this field that whatever it takes for people to understand how important this issue is, whether you're coming from the side of business or the side of I don't know what to do. I'm a new parent, I'm a new mom, and I'm lost. And I feel like a foundation, right, an organization, a company like yours, Amy, is really the bridge. So before we go on, I want to make sure that people know right from the start. And think about it if you want for a minute, because I really want to know, just as PSI has specific arms and reaches and purposes, but it's not just one, I think we have that in common as companies that CPLL does too. So PSI, for an example, provides direct support to families, peer support. We train professionals to be specialists in perinatal mental health, and we get involved in policy, but we're a bridge to connect the two. And many companies or groups, maybe who are listening to this, have similar ways of identifying what they do. But I think as I've gotten to know CPLL over the years, I think you do so much in so many ways. And I wonder if you could just describe for folks both what you provide and also how they can get into that, like how they can find you. So can you just give us an overview?
Yeah, let's take a second on that, because there's also a history there that's sort of important, just for the field. As you know, when you're starting something and you're trying to be everything to everyone because the other parts of the ecosystem haven't been built up yet, you've got your hands in everything. And so that's where we started. We started with policy advocacy. We started with trying to do more research and get a research base in the US. We started with consulting and coaching. I think where the first step into this was when I created the RETAIN Parental Leave coaching method. And what that was a very specific, what that is a very specific coaching framework that I had to fight my school for 2 years to allow me to do my dissertation on, because it didn't exist yet. And so they kept saying, you can't study something that doesn't exist. And I kept saying, that's the whole point. I want to create the thing that doesn't exist. And finally, after 2 years, they relented just to get me out of there, I think. But what it meant was I looked around to all the different fields that influence at this time. And so we know that involves inner pieces, it involves company pieces. So there's career development, there's work-life balance, there's identity pieces. There's a whole host of different impacts at this time. There's stuff that happens at home with partner relationships. There's so many different pieces. And I drew from all of those to create this framework. And then it was all theoretical. And what we had we were invited to come to Australia and test it out and see and do some pilot work there, because they had just passed a gender reporting law in Australia that all of the companies had to publicly announce how many women they had at what levels and what their pay was and how many were falling out. And all of the companies got very, very embarrassed and realized that they had a big, big problem. So they were seeing 40 to 50% of women falling out around the time they became parents in their careers. So we were able to go and test this out over a couple of years and get really, really strong data on what worked, what doesn't work, what touch points everyone navigates through no matter what their situation at work and at home, and which ones are more unique to them individually. So where's the the flow through for everyone and where the pieces that need to really be customized. And then we've since gone on and brought that into our consulting work. So Wendy, that just a little context, like you have to sort of do everything and then learn from that. So now what we do, we do policy development. We help companies either improve or figure out their policy. We do research, both external research of our own. We partner with organizations to do public research, and we also do internal private research for different companies to make strategic decisions around what they want their policy and their supports to look like and what their employees think. We do research, consulting, we have assessment tools. I think one of the most impactful things that I'm most proud of creating, are our assessments. We have the Parental Leave Transition Assessment, which is the only evidence-based tool. Think like a Gallup Strength Finder or DISC or an MBTI. And the employee, we have a manager version too, but the employee takes the survey and gets a customized 22-page report that guides them in where to spend their limited time and energy. You know, what are their strengths? What are their weaknesses? What are their, what we call pivot points? And that gets integrated into our coaching. Sorry, I think I'm taking a little too long to say all this, but then our sort of, I don't know what the right word to call it. We do RETAIN Parental Leave coaching. So in the last 3 years, we've moved into training and development in a much stronger way. Before that, we were doing it all internally. And we realized through the pandemic, this isn't moving as fast as we want. We really want a groundswell within this country. And it's time to spread the seeds. So we have been really lucky to have 5 cohorts so far go through our RETAIN Parental Leave Coach Certification. We have coaches now, over 100 coaches in 35 states and 5 countries, and doing wonderful work all across the board. Some of the people that go through our program are therapists. Some are we have a whole birth worker side of doulas, lactation consultants, OBs. We have on the workplace side, HR, leave professionals, external leave professionals who focus on policy and want to integrate some of this into their work. We also have in-house leave professionals. I've been advocating for many years that where this is heading is all large companies, at the very least, will have internal leave coaches, leave support people. And so we're doing a lot of those. People are getting trained now and certified. It's pretty exciting.
It's really exciting because did anything like this exist before you created it to have parental leave coaches, period?
No.
Okay. I didn't think so. I certainly haven't heard about it other than what I've read from you. And also, so help me understand anyway. So if someone goes through your parental leave coaching certification, first of all, we put the link into the chat. Thank you for that, Jessica. If they go through that, I know I think that there's 2 ways that they then move forward as a certified parental leave coach. One is you might be doing it within a company, like an insurance company might say, we want to get 10 or 20 or 50 coaches, and they'll onboard them, have them be certified, and they work for this insurance company. Does that happen? Is that true?
It is.
Like it happen more?
It has to happen more.
Okay, thank you.
And I think the difference is there are companies that are starting to recognize it and ask for it, but there's companies like Maven and Carrot who offer services around this time to companies. Yeah. And sometimes therapy or doulas are covered under those companies. Okay. We want and I Maven and Carrot, I will reach out to you about this. This is something I've been thinking of. We need to have a retained parental leave coaching components of those programs because it is different. It's a different piece. And so there's a few people out there right now who are calling themselves parent coaches. There's a lot of people calling themselves parent coaches, and that gets confused with parental leave coaches. So if for companies, they need to understand that if someone's calling themselves a parental leave coach, they really need to be asking them, are they certified? What's their background? Is that just because they had a child and they've experienced it themselves and they've liked to move into this? Or is there something that's really behind their ability, and are there tools and resources that have been proven to work that are backing that parental leave coaching? So RETAIN Parental Leave Coaching is the only certifying program so far as we know in the world. And so we have people from other countries coming to us for this. Yeah.
Thank you, online training.
Thank you.
Thank you for that, because I think that's really important for people to understand that, of course, you're supportive and interested in all the things and all the branches of services offered to companies and to parents. But we want to be really specific, as we'll dive into in a minute, just like we are with perinatal mental health specialty, that parental leave coaching is a very specific set of, it's skills and knowledge and understanding. And that's what's important for companies. I know, for example, for PSI, we've utilized your consultation, and it's been so helpful because we know a lot about parental coaching and support. We know a lot about that, but we really needed to know more about what are the policies, like what do you do nationally? What if you have people in different states, which is very true for PSI. We have employees all over, or other countries. And how do we as an organization or a company really make sure that we're providing the parental leave coaching we need? Because what Amy and I both know is the more efficient your support of new parents can be, the more productive they and you will be. And so when you're fighting the fight to say this is a priority, and it's different than an EAP list, unless the EAP includes parental leave coaching, those are the hardest questions.
Yeah. And Wendy, you bring up a point that I want to clarify for everyone, because it's so confusing. And everybody, when they think parental leave, they just think pay. And really what we're talking about and what we're trying to shift the culture in this country around is parental leave has policy components for sure, right? That's your pay. That's how much time you have off. That's your foundational information that you need. And then there is programming. So programming around parental leave is manager training, parental leave coaching, any other benefits that you might have. So maybe you have milk stork, or lactation rooms, right? Like those, I would put under programming. What are those benefits that you're offering? And then there's the practice of that. So that's more of the culture of your organization and how it is enacted within your organization with employees. And those last two, programming and practice, are where we focus heavily. Of course, we can help with the policy development, and we know, how to do all of that. But that has really been taken up by the legal side of our country and the HR side of our country. There's a lot happening. There's other people doing that work now. So we've gotten to set that one down a little bit to focus more on the practice and the programming, because that is the one that is getting ignored. And it is, of course, we need pay and we need time off. But that to me is an inevitable, like we have that in 13 states plus DC. We will have that in the whole country at some point. And even in states that don't have that, there's companies are moving to do that because it's needed, right? And it's also a safety and risk issue for companies. They're starting to realize more and more.
And I'm so grateful for the people involved in doing such a great job with policy development, because we're trying to look at that nationally and have that conversation. And I'm really grateful for the practice and management development, because what we know, and this will get us in a minute to the intersection of mental health and stress
Mhm.
and parental leave, is you can have the best policies in the world in your company, or a mom that previously understood everything. And suddenly, like for me, once you have depression, anxiety, other mood disorders, or trauma, and a new baby, it's like I didn't know anything. I couldn't remember how to read. So,
Yeah.
how was I supposed to remember or find the employee manual? What if I had had a coach? I'm going to cry right now, I think.
Mm.
What if I had a coach, my God, that I could just say, I'm lost, but I want to, and I need to go back to work. For some people, in the, thank God help us, a couple weeks or 12 weeks, or like I don't know even where to start. And I had all this stuff and I can't find, like, I can think of so many ways that I could have talked to a coach at that time, which is really different than a therapist. Also needed a therapist, but
Very, yeah.
we need someone to help us navigate back. And so I want to talk more about that. I want to make sure we get to the other way that certified parental leave coaches are utilized, and that's when they start their own coaching practice.
Yeah.
Know that you do with your cohorts. Remind us again, two things. How many people have you certified? Two, because I see one of the comments on our Facebook, hello, says, how do I become coach certified? So how is it just in certain locations? This viewer asked, or is it from anywhere? And then let's move into what a coach might do, because I think that's really interesting. That gets to our intersection. So tell
Okay.
us more
Trying to
about
remember those questions. I also want to pop real quick back to the policy thing that you said, because there's policy creation, which people are doing wonderful work around, and on the state and the federal level. What we're doing in our policy consulting is how are you using your policy strategically for your goals within your organization. So anyway, if anyone's interested in that, happy to talk more about that later. But we have through the 5 cohorts so far, I try and cap them at 30 people or less, so that we can all see each other and everyone gets to know each other, because again, we're trying to build a field that is evidence-based and human-centered. And the way to do that is by everyone getting to know each other and being able to ask each other, create a network. It's what PSI has done over all these years. It's very similar. So 110, I can't remember the exact number of people have gone through the whole program, passed the exams, and graduated in 35 or 36 states and 5 countries. And it is anywhere in the world. It's a virtual program. We have our 6th cohort starting in September, and I'm very excited about that. And because we've learned so much, what we did the first cohort versus what we're doing now, and how we're able to train and support the participants is night and day. Sorry, first cohort. Although they got to learn too. I think you asked, was there any other parts that you asked in that, Wendy? How many?
I think we have in the links how to find out more about it. Is there any eligibility requirements before you become part of the cohort?
So at first, I really thought we would have that, but I chose not to, because again, my goal is to really build a supported foundation for this field to grow from, and every parent needs this kind of support. And so what we found is that the way to do that is create extremely diverse groups. So having people who are working internally within a company, having people who are doing therapy, having people who are working with underserved populations, having people who work working with way overserved populations, having different ages, having different races, having, different genders. All of these things go into making a really interesting, supportive community of coaches, and where you can learn from each other, not just what we're teaching. And so I think I know that the one unifying piece is that no matter if you're in, a deep red state, firmly believing that that is the way to go, versus a deep blue state, firmly believing that is the way to go, every single person comes with a passion to change the way that we support parental leave in the United States. Most come, not all. We have a lot of coaches we've got a handful of coaches that have come through that are not parents yet themselves, but feel very strongly about this. But most come with their own experience and went through it and learned how bad it is and are trying to make it better for the next.
And how it's a set of skills and knowledge that's teachable.
Yep.
So one of the things that I really have appreciated as I've gotten to know the Center for Parental Leave Leadership is that you are creating a system through which individuals or companies, but just focusing on the individuals now, can get the training, become certified coaches, and then really increase their own possibilities of career.
Yeah.
So they don't work for you. I think that's different. Yeah.
Yeah, it is. So if you think about it, when I just call everyone our coaches because I love them all. they're RETAIN certified parental leave coaches, and that makes them part of our network. But most of the people that go through, they're not coming to work for us. They're coming to either integrate the RETAIN frameworks or tools and resources into their own therapy practice, lactation support practice, whatever their own practice is. They've just realized that they don't know enough about what's happening in that transition in and out of work, but that their clients are struggling and they are coming for more information and a way to help them. And so some have actual RETAIN parental leave coaching companies, who are starting their own coaching companies. Some are adding it to a practice that's already existing. So they might be an executive coach, but now they're going to also be a parental leave coach. They may be a therapist, but now they're also going to be a parental leave coach. So they can either add it as a separate entity in their offerings, or just use the knowledge and the tools and the resources within an existing practice to just augment what they're able to offer.
So great, because that is what everyone's looking for. Like, how do we improve things across the world for families, and how do we create more job experiences and more, actually, a broader range? So I love this. And what I'm hearing and understand from you, you don't have to be a therapist or in the helping professions. You also probably have coaches who come at it from previous experience in other industries and professions, or a returning to work parent.
Yeah.
Yeah.
And the way I look at it now is that each one of those people, especially in these early days of the field, they're going to bring their own flavor, their own expertise. They're all influencing where this goes and how it impacts the country and the world. And for me, one of the core values that we have is that we're not just talking about workplace productivity and loyalty and retention, as you were talking about earlier, but we're talking about a human transition, a life cycle transition that's sacred, and when supported well, can really set that person and their family and their partnership, if they have one, up for success for the long term. And if they are not supported at this very critical moment when they become parents and that family forms, whether it's that first or the second or third, fourth, fifth child, it goes the other direction. And we've seen that over and over, and we want it to stop.
Absolutely. So let's talk some more about, there's two parts of this. Of course, how do you see the connection, the relevance of perinatal mental health in parental leave in general, parental leave coaching?
Mm-hmm.
There's so much we could talk about here. And then the connection between Postpartum Support International and CPLL that kind of has grown out of that. Do you want to talk about, like, I'll ask it like I don't know. I'm sure you've been asked this before. Well, is mental health really an important part of this? Shouldn't that be saved for counseling? Or, what does this have to do with parental leave? And how do you get there?
So my own personal experience and what has been confirmed over 2 decades now is that it very much has to do with this time frame and with work. And what we don't have yet in this country is a lot of research that says, oh, if we make these changes in the workplace, the perinatal mood and anxiety disorders decrease. But what I know anecdotally and qualitatively from all of our coaching work is that that is very much the case. We are able to decrease anxiety, decrease depression, increase confidence. There's personal we all know that when you're supported well through something that's hard, it makes you feel better. Yeah, I forgot your question, Wendy, because I want people to know that. I want them to know how much it matters. I want workplaces to understand that they need to bring an awareness of perinatal mental health to their workplaces and to their culture. They need to be training their managers in how to understand and maybe take a pause to say, oh, is that happening because they're a bad employee? Or is that happening because something else is going on that needs some support?
Right. Well, you can really address it. I know that you have, I've seen you I love your social media and I follow that, and I've seen you post things about studies like the Moms First study, about how especially moms are thinking about going back to work. And when I think about it, I think the other way first. I think, well, let's just say what would happen if you don't have resources? That's what we're talking about. We're not talking about the
40% of your workforce will leave, or your female workforce will leave, right, within a year. So if you want to lose 30 to 40% of your female employee, I guess we have to narrow it to your employees having babies or adopting babies, having or adopting, you'll lose 30 to 40% of them within that first year. And when we did the study that I mentioned in Australia, we dropped a 44% attrition rate down to 0 using RETAIN Parental Leave coaching. We had 0 attrition within the first and then the second year in that study. Because they were supported, they were resourced well, and they were given a formula to create a pathway back to work that worked.
Yeah, I think that's part of what's frustrating to me, and I wonder what your thoughts about this are. That there's lots of different ways of saying this, especially in the United States right now, but in other countries as well, which is it varies from, we want to help parents get jobs. We want to help people get jobs. We want to help parents get back to work, all the way to, I'm quoting other people, every parent should work, or in order to be eligible, for example, for insurance and Medicaid, everybody should work. So where there may be some room for, well, we won't say they have to work in the first 2 weeks, but I feel like in whatever that conversation is, whether it's benevolent and saying we want to support our parents, or whether it's about regulations and cutting costs and Medicaid and things like that, well, I feel like what's missing is, it's just like saying work is a value, go do it. And tell us what you feel about, well, what else should we be doing or can we be doing? And I'm not just talking about the federal government, although that is included, but I mean, like, what can anybody here, individuals, coaches, companies, government, states, be doing to really make that possible for people? What's missing?
What's missing?
Yeah.
The hardest thing, which is a culture shift
Mm-hmm.
in how you think about this time. I mean, when you go from thinking about maternity leave only
Right.
as this thing that women do and you can't talk about, and is just about pay, but you just sort of like, they're going off and they're going to come back and you don't even, that's their thing. You don't want to get in trouble for talking about it. When you go from that, which is where we've been for, I don't know, at least the last 50 years since women started entering the workforce in larger numbers, we have to shift that to thinking about this time as a standard and normal and common part of the employee life cycle that happens for up to 80% of employees at one point in their career. And it's normal and it's procedural and it is happening over time. It is a year of time. It is not just these 6 weeks, 12 weeks. It's not that. It is a year. It is preparing to go on this leave and thinking about your work as you're preparing to go on leave and handing it off to someone.
Okay, that makes so much sense. Okay, just that, I think
And then,
people don't
and then
ever
the
think
return.
about.
Yeah, sorry.
Just like in postpartum mental health, people act like that should start right after the baby's born, but in the exact same way, you're saying parental leave planning should, of course, should start early, even maybe before you're pregnant, but certainly when you are expecting a child, or that's by birth or adoption
Or adoption or fostering. Yep. And it's not like, this is the thing. It's one of those mind shifts that as soon as you get it, you're like, oh, duh. Like, of course we knew that all along, but we're not there in mass yet. We haven't hit that tipping point. And so everyone who goes through this and starts to say, the parental leave transition. I remember the very first time I used those words. I was at Barclays Bank in New York. And I said to this team of leaders, I'm talking about the parental leave transition. And they were like, parental leave? What's parental leave? Do you mean paternity, like men taking leave? I was like, no, I mean like parents having a life experience over this time frame of transition. And they were like leave? You know, like they were words that didn't fit at all in their understanding. And it is still that way. We're still there in the US. So everyone who starts to talk about this as a year of time, that is very easy to support. It's not difficult. It just,
is that going to cost the company a lot of money though?
It's not a lot of money. It's not, you can do things for free. Like it's really quite simple.
Sure.
So then there's the preparing time, and you're thinking about, I'm often, one of my favorite quotes I'm quoted saying, right, that is a quote of me talking, is the best way to prepare for leave is to plan your return. And I think it just sums it up really easily. When you're preparing for leave, if you are not planning your return and you're not thinking about what you want that to look like at home and at work, then you aren't creating that path back for yourself. And so a coach is fantastic because they can ground you, they can hold perspective, they can remind you of how brilliant you are when you start to doubt it after you've been on leave for 6 weeks, 12 weeks, and you're feeling horrible and dumb and dirty and tired. And, you have a loving person to meet you and say, hey, remember before you left and you told me XYZ, you still are that person, right? Remember when this was your dream of what you wanted to do. You made that path. You can still walk it. Like, there's just something really powerful in having someone walk through that whole time with you at the center of their goal.
Right. I can imagine that a parental leave coach, whether it's internal for a company or external, someone in their own coaching business, helps a lot like the PSI peer mentors do.
Mhm.
PSI provides a helpline so
Right.
people can call or text or message the helpline, and they have a one-time conversation with resources and encouragement and information. But if someone wants a longer relationship, they get connected to a peer mentor, which exists over months. And I know that sometimes the most important thing, and the thing that so many people struggling with, especially perinatal mental health, and I know this was true for me, is I just need someone to help me take one step at a time and to
Mhm.
not get overwhelmed. So I imagine, given what you're just saying, that that's a lot of what goes on inside a coaching conversation, is helping someone remember what step they're on or how to
Where
just
they
take.
are. Yep, exactly. We start with an evidence-based assessment that I mentioned, and what that does is it guides those assets, those liabilities, and so you can have a conversation around we have values exercises and all these things to ground that early conversation where that parent can say, oh, I do overtly want to live the next year of my life with these values guiding it. So how do we operationalize those values, knowing where what your assessment is showing you, there's a risk score within that assessment. So companies can understand, we can aggregate all the data for companies. It's a really special tool. Yeah, nothing like it exists. And the risk
A
score.
risk assessment, like a screening for risk, like the Edinburgh postnatal depression scale, for example, screens for risks. Like, we know another wonderful company, Ingram Screening Services, also in Portland. It's in the water.
Indians in Portland, interesting.
Can't help it. That provides training on how to screen specifically in companies or for providers to say. And this is so important what you just said, Amy Beacom, which is assessment and screening tool is not diagnostic. I'm just going to say this again. When we start talking about things related to mental and emotional health, often we run into people, rightly so, I'll say this, who say that's out of our scope, we're not doing counseling. That's not the point. The point is, how do we assess for risk and safety? And so you're saying, as part of the training you might provide to a company, or a parental leave coach has gotten training to know, how do we talk to people and assess for risk so we can do better planning?
Yes, and we actually have both. So we have that one as part of our workplace, as part of the PLTA. It's assessing for risk, and we're very, very firm on confidentiality. So we don't
Yes,
go to a company and say this person's at risk. But if they have enough employees, we will go thematically and consolidate over themes.
that's a great point. Thank you.
Yeah, but when I say if they're at risk of harm, we will of course intervene that way. But it's more about paying attention and figuring out where to put resources. So if some employees have a risk score over a certain amount, then a company might choose to give them more coaching hours than somebody whose risk score is low. But then there's also the workplace perinatal mental health screen, which we created many years ago, which is the Edinburgh. But what we do with it is we created it for use in the workplace, and all of our coaches do that screening, not diagnostic tool, at every session. So you're able to track that parent where they are, which is at work, unfortunately, too much, and then also at home through that whole year of time. So we're not just catching them on a 2-week post-birth visit. We're really getting to see, okay, this is their baseline. This is where they are. Are they going up? Are they going down? What resources do we need to support them with more at these certain times? And all of our coaches do have training from PSI, and many of them also have their PMHC.
Perinatal Mental Health Certified Professional. So yeah, we have worked together, and that's to a large degree how I got to know more about your work. And I want to say a couple things. I'm so grateful that you exist. I'm so grateful that your coaches exist, and also that companies who have really understood your message and worked with you have led the way, companies and organizations and councils, to say we want to incorporate this. Because once you start talking and people, listening to this, it just makes so much sense. It makes so much sense. Why are we not just incorporating this? So I want to say that. And then I know because of you've invited PSI into at least one. I mean, you've learned a lot about perinatal mental health through doing this. And as is evidenced in your book, shout out to ABB.
Thank you. I did also write the
Back.
first and only book about parental leave so far.
So we'll definitely share that in the comments, but also that so you've invited us in that your coaches have one full session taught by PSI faculty on screening, assessment, the signs and symptoms, how to talk to people. And I know that I got to do one. Tiffany Conyers has got to do several, and I love that we have connected and integrated in that way. And PSI is just very, very excited about, well, first of all, the fact that you asked. We love all kinds of programs that train people to support parents. We rely on those that include information about perinatal mental health. Well, if you left it out, how could we proceed?
Well, I don't even know how to say how much I value PSI. So I just like all of our coaches are educated in all of the PSI resources as well. So if they're in a coaching session, they can say, "Oh, do you know there is a Army Dads group of online that you can join through PSI?" Or even in our workplace perinatal mental health screen, the results all are sent to PSI. Like they're given up the PSI resources. So
I got to consult to you on that for your book.
Did.
Thank you. Thank you for, you have to have the resources. So before we finish, there's a question I want to come back to, and then I want you in the other part of your brain, because obviously you have a great brain and you can do
parts of my brain.
think about what else you want to make sure you say before we close. But I want to go back to something you said. I want to make sure I understand it, which is maternity leave, quotes, is not, we're afraid to talk about it, or it's quietly talked about. Do you mean as an employer that we're afraid to bring it up? Is that what you mean? Or do you mean also as an employee, we're afraid to bring it up? Maybe both. What are you saying there?
Yeah. Thank you for asking that. When I was talking about it a second ago, I was talking about from the employer side, and from most specifically from the manager side. HR, they'll send you to HR, but most people are interacting with their manager around leave. And so if you're a new parent, you're going to go to your manager and they'll say, go to HR. But you're having to, your team and you need your manager to be informed. You need them to know how to navigate leave well with you, how to support you. And in this country, managers are not trained in anything around parental leave. That has been
unless they've met you, but sorry.
That's a risk area that they're sent to. It's considered a legal risk area, and go to HR and they'll take care of it. And that does a real disservice to managers and to their direct reports, because it doesn't give them the information to actually support them. And so they're worried they're going to say something that will make the company get sued. And so they choose not to say anything at all because they're worried they're going to step in it and say something wrong, or just hurt their employees' feelings. It's a very tender time, and all emotions are high. So we have manager training that we did research Purdue University and Oregon Health Sciences Center, Healthy Workforce Center, did a big 2-year study that we consulted in them to what to create around parental leave research, and it's proven to work. It's in a journal now, and so we have all the manager I'm talking about manager trainings right now. So those you can train your managers to say what they need to say. I think my daughter just tried to walk in. It's summer break over here.
That's okay.
Let's see what was I saying? But it's also the man. Yeah. Speaking of work-life balance, it's also the parents. They're worried they're going to say something and they're going to get fired, or they're going to get demoted, or the promotion they were angling for, they're not going to get. They're going to be stereotyped. All of these as soon as we start talking about parental leave as a normal part of the employee life cycle, all of that goes away. If there's procedure, if there's structure, if we say, oh, yes, you go to HR for this, but I'm manager now, but I have these tools and resources also, and I can hook you into this hub, and I can get you set up with the coach, and let's get a regular cadence of meetings on the calendar so we can check in with each other, so that manager feels empowered to have a simple conversation.
Amy, when companies have decided to contract with you and get that training, or organizations, and what made them decide to go for it? What did it take?
As a company, I'm always trying to look for that why, so that we can replicate it and get into more companies. But the theme is, it's an individual within the company who has had their own bad experience, and they are trying to fix it, and they're passionate about it, and they're in a position where they have some power to do something. So
that makes a champion.
It's a champion. It's what it is. And we've had it trickle up from a parent who was part of an ERG, or somebody who is in HR. We have, heads of companies. It doesn't matter where you are. It's just that you're loud and you're vocal, and you're wanting to bring some change to your organization to improve it.
ERT.
ERT?
What did you say? A parent who's a part of
ERG. Sorry. Employee Resource Group. Yeah.
Thank you.
Yeah. Sorry.
I have so many questions in my head, but I'm going to try to pick a couple. If I don't know that you do this, so take your time. If someone's listening now and says, I'm that person, I work for this I work for this company, I want to be a champion here, I want to go to my administration with good information, would that be something they could work with you about, or no? It's
100%.
Okay.
So if that's the case, we have decks that are designed to empower people to go and do that within their company and have those conversations. I'm happy to share them with anyone who reaches out. So, and support you in brainstorming how to do it. That's one of the main things we do, because we're not a normal company. We're sort of a change the world.
Oh, one of those change the world companies.
Change the world companies. Yeah.
See, back to waitressing. It's important to know you deal with each table and what they need and what you can do for them as you're looking at the whole community. So Amy, so I think that's so important, because I didn't know that. That's why I asked. So somebody listening here can say about, let's just get really clear again, about parental leave, development, coaching, management training. If they want to be part of that change in their company, they could reach out to you.
Please do.
Reach website and say, I think I could get my foot in the door anyway. Can you help me with the information or the slide deck? I love that so much, because that's how we can make differences. And you're saying that's already happened. So that's good to know. Another really super quick question. I was thinking too, and then somebody asked here, you want to give us a quick, and should be a long, we'll have this conversation. I want to talk to you forever, but this
what?
Good, and does parental leave include perinatal loss, abortion, miscarriage,
Our
stillbirth,
our
loss.
training does. Is that what you're asking?
Yeah.
Our
Hmm.
certification and training does. We want all of our coaches to be able to support and to help managers understand how to support around bereavement, around loss, around miscarriage, around IVF, around happy births, around hard births, around adoptions, around fostering. We're looking at this as the whole gamut of what you may experience over this time frame. And we didn't even touch on IVF, but that is often a really difficult journey
Sure.
that a manager is co-navigating with their direct report.
100%. I can imagine now that you have helped us shift our mindset to parental leave starts in pregnancy. That also would include difficulty IVF, or could include hyperemesis, which is severe nausea throughout pregnancy. That's also leave planning. And I know for PSI, we do have parental leave, which is, it's important we're calling it that because it also includes all genders, but parental leave includes difficulty during pregnancy and loss. And were helpful in really helping us look at what works for our organization, even though we're not a fancy, rich corporation, we're a nonprofit. And we're a really good case example of you helping the nonprofit figure out, well, what can you provide? What are the benefits? But probably as important as benefits is what's the conversation like?
Yep.
And where are the resources? So just like CPLL coaches, parental leave coaches are trained to refer to PSI. PSI is trained to refer to CPLL. And so I just am so grateful that you have existed all these decades. You're like they say about artists, a one-hit, overnight success, but really you've been doing it for decades.
It's what we haven't done. Sorry, Wendy. What we haven't done, because we've been busy doing the work and changing the hearts and the minds, is we haven't done our advertising well. So it's really, really fun to be on here getting to talk about this. And I really appreciate it.
You could have the best restaurant in the world with the best cooks and chefs, and you're on time every day. But if people don't know you're there, they'll keep walking by. So we are more than happy to illuminate and put your name up in a big billboard, because when you put it all together as you just did, it just makes sense that this is something missing, and that I swear to God, I'm going to make a bumper sticker that says hashtag now more than ever. But now more than ever, we really need to know how to support families like this in these stressful times. So, okay.
Yeah.
That's a question you always get on these kinds of conversations. Did we miss anything that you want people to know about the subject or about CPLL or anything before we finished?
I think just my one thing that I really want people to walk away with is to stop thinking about parental leave as just pay and time off, that this is a life transition. And if you think about having a child, that you call us, reach out, email to the info@cplleadership.com link and say, hey, can I have a half-hour call with somebody to just orient me to the things I need to be thinking about during this time frame. And then my more pluggy things are, please join us on Tuesday. Is that tomorrow? Tuesday for our Q&A about the Fall Cert program. If this is at all if you're interested in becoming a certified coach, or
say the dates because we're being recorded. So it is in the comments, the link's in the comments, but there will be a live Q&A. Go ahead.
June 17th.
Great.
Which is tomorrow, if you're listening live. You can access that on our website to register for that Q&A live. And if you are interested in the Fall Cert, apply. There's an apply button that is in the links too. We do that on a rolling basis. We cap it. It's a first come, first serve fill up. We do have something we call the Parented Forward Scholarship, and we do create one every year with PSI. So keep an eye out for that, but you can still apply and say, I'd like to be considered for a scholarship in this amount as part of your application. Tell everybody about us.
Tell us about your book again.
My book, here, I have it behind me, so I'm going to grab it.
That's beautiful.
It sits behind us. This book was written during the pandemic and got lost in the pandemic time. I didn't even get to have like go to a bookstore and do signings. So it's called the Parental Leave Playbook, if you can read backwards. It was
it's forward for us.
Oh, is it? Oh, good. It was published by Wiley, which is an academic and a business press. It's one of the top 5 presses. And this book was written to be a coach in your hands. So as if I'm coaching you, a parent going through parental leave, and what you need to be thinking about and talking about the leadership lessons of this time and how to incorporate a lot of that leadership into your from home into work and from work into home. And every manager, you should buy it for your manager to give them a window into that employee experience. Every manager and every parent should read it, because it's the only guidance out there that really grounds you in both the practical pieces of this time and the emotional and psychosocial parts that you're going to need to consider.
I've read it. It's brilliant. I agree completely. I just couldn't believe that you integrated so beautifully, like brass tacks, good information, resources, storytelling, case examples, and like what you would call what should be standard tools. So thank you, Wiley, because I think that Wiley does put out they really like practical stuff. And so the marriage of you and Wiley turned out
an interesting one, right?
Yeah. So thank you, Dr. Amy Beacom.
Thank
and
you.
If y'all are looking at this as a recording, do put questions into the comments on CPLL's social media and PSI's. And I just really appreciate you so much.
I appreciate you and PSI and your whole team so much. And I know this is on all the PSI socials, but you can also reach out to me on LinkedIn or different ways through us too. Thank you.
Thank you. Bye, everybody.